So any person who want to share on what we actually learned yesterday, what was the key takeaways from yesterday's sessions, the 3 sessions we had in the morning on digital transformation. We had issues of accountability, and then later we had the issues of risk and audit aspects, audit and compliance. So those were the 3 sessions. Any key takeaways from the session in the morning, the first session you had with Mr. Alex Onduko, the Chief Officer Finance from one of our subnational units? Any key takeaway from that session? Yeah, I'm directing it more specific to a session so that we are able to get more information. Were we here yesterday? Oh, yes, we were. You know, when I'm not seeing anybody raising an hand or trying to suggest that he or she is willing to speak, then I'm like, we were not here. Anybody? Okay, we start from our... Yes.
Thank you very much, Mwalim. I think we heard yesterday that systems are better and they are more efficient when they are automated. But I think there was just something that was missing that we would have liked to hear. The outcomes in terms of the benefits to the service to the people. Examples of what has come out of it in terms of development. You know, maybe that would have made us to get to understand that, yes, Kwale is exemplary, and I'm not saying, of course, the discussions were terrific. It was very nice. That is where we are headed for. Automation is not something that we are going to take for granted. Things have changed. We know all of us are here, and you know, especially in our country, we can say that we've done very well because we can transact while we are seated here in this room. Courtesy of course, the banking world that has changed things. But I think it would have been more complete if we had of examples of achievements and gains that have been realized directly by the people of Kwale. Because he mentioned quite a great deal that Kwale was seen to be, they had come up with a system that was seen to be the best. But now, we would have liked to see some evidence of it. How has it helped the people? I know he mentioned that Kwale, their city, because a county government, the headquarters is tucked somewhere in some place, and then they are focused mainly on Diane, and you could see actually they have realized so much, because if you talk of Diane alone, moving revenues into in excess of 300 million shillings, you know, and than earlier, you know, much more than what was collected earlier before the automation of the systems, then it tells you that then the business also must be booming there. So what could have happened? Now, from that boost, because of the automation and more collection of revenue, how has businesses expanded? That's what we would have wanted to hear. Maybe in future, that's what should happen, so that we see the gains of automation. Otherwise, the information that he gave was very good. And I must say that sitting down and picking a system that has been developed here in Kwale, and it does a very wonderful job in terms of revenue collection. And it's an original thing that has been done by themselves. In itself, I think, is a major gain, and it means there's a lot of potential out there, that people given room to innovate can do wonderful things. You know, we would think that innovation can only be found in places like maybe the cities and Nairobi, for example, but if something good can come out of some place that is almost detached from what you would expect to be, you know, sophisticated environment, but they still come up with some things that are very good, in itself is a plus for them, and kudos to them for that development. Thank you very much.
Thank you so much. Very elaborate engagement in terms of what went on in the digital transformation, and taking note of what more could have been added in terms of the impact of the systems in the growth and development and the impact to the citizens of the county. But nevertheless, appreciating that the systems are there and they are tangible, basically experiences, but more of the linkage to outputs and outcomes of that system. Thank you. Another person in that digital transformation, a big area actually in most of our organizations, and we will still have some discussions, and I believe the presenter today may touch part of those system aspects. But let's get more information. Any other person wants to add on the first session on digital transformation? Now I can see people are busy looking down. I don't know what is down where you're looking at. I know my face may not be appealing to look at, but I request that you keep me company for now. Don't leave me alone here. So it's good we share and agree what is there. Okay, then the second session. We had Mr. Ngote dealing with the issues of governance, things to do with what? Zero what? Tolerance to corrupt practices. Great takeaways from that session. The session number 2. Anybody? You now expect to get more answers from all of us because we were here. Yes, here. Another person, I need 3 so that the mic moves among 3 people. This 1, 2, 3. Okay. I'm likely to be presenting from back there. I don't know. The people back there, are you getting me? The people at the back, are you getting me? Eh? Are you getting me? Oh, yes. So I'm coming back there in a moment. So please, let's also join in this discussion. Don't leave us alone in the front here. It's very cold if we don't get you to speak. Okay, Director?
Thank you, Mwalimu. I was actually very surprised to learn that there is what Mwalimu called a romantic approach to corruption, that people had thought about it and saw it as fit, as being the oil and grease that oiled the wheels of economic growth, allocating resources where you are able to pay high bribes. But it is good that those approaches and theories have been discredited and abandoned, because at the end of the day, I think corruption is an evil act. Secondly, I was, let me say, I learned that, and of course I knew that Africans were not actually corrupt, that the value system, the traditional value system of African society uphold corruption. Mwalimu went on to tell us it is the influence from the external forces that changed Africans' mindset to become greedy and prone to corruption. So my contribution is, if indeed that is the case, then we need to go back and see what those inducements and external pressures on Africans, what they did to his mindset, so that we can begin to deconstruct what was learned. And the only way, in my view, we can do this is through operant conditioning. Operant conditioning is the only way we can change behavior. And this is through teaching new things, imparting new skills, new knowledge, and new attitudes that will bring about behavior modification. Because laws alone may not help us to adequately deal with corruption. We need to have a changed value system, and it has to be ingrained in our education and training approach. Thank you.
Thank you so much for that quite also elaborate discussion on the whole process. Maybe what we may ask ourselves that are these things we start engaging right from the early childhood, that it's entrenched right in our life from the young kids upwards. Maybe we may have to check that and what we need to do from the earliest time possible in the human growth and development. Okay, thank you. Let's listen to Hausa.
Thank you very much. Mwalimu talked about the types of corruption. He also shared with us the causes of corruption, measures to combat corruption, and also prevention. And one of the major takeaways was that he told us about the African Union Convention on preventing and combating corruption. I wasn't aware about that. And this is a very critical reference document for all of us. So that was one of the major takeaways that I really loved. For some of us, of course, the major monster in the room, we highlighted as the challenges of fighting corruption. They are huge because corruption fights back. Thank you.
Because there are quite a number of things yesterday and the mechanisms and the strategies we have been put in place, and of course right from the UN Convention, which at one time required that countries develop some of the anti-corruption academies. And I know we have an academy within the Ethics and Anti-Corruption Commission in Kenya. And as a school, we have an institute which deals with ethics and integrity. But of course, this one also go to how do we entrench them into our day-to-day activities. Thank you so much. Yes, sir.
Thank you. Let me add my voice in recapping what we did with regard to corruption, which was presented very passionately. And I think one thing we got yesterday, starting with the corruption song, and one would make us think that this course is basically about corruption because audit and many others, financial management, all are meant to curb corruption because corruption is a horrible disease. To me, even the definition might not even capture what is corruption because even failure to perform, laziness, lethargic work, all that could end up being described as corruption. But of course, there are several levels of corruption that were described from bureaucratic corruption, political corruption, and many other things that relates to corruption. And of course, there was a point on governance, good governance, that of course, if we are all to embrace good governance, then would ensure that then corruption is also very limited. And there was this definition or description of corporate governance, the authority, accountability, stewardship, leadership, direction and control exercise by the organization. It was properly summarized. But in my thinking, and the role of even the association should be really within Africa to really strongly fight corruption. You can really put a lot of things that are normally not right and classify them as corruption, meaning that you can widen the definition of corruption. That's my view, because really corruption is really obnoxious. People delaying to do work, corruption fighting back, like my colleague mentioned yesterday and asked a question regarding corruption fighting back. An officer here knows very well he's doing wrong things to fight the management and would corrupt the system just to fight back. Lawyers and the judiciary playing a role in it and making it even more murkier. Sometimes it becomes like a personal agenda and not organizational or institutional. People delaying in project implementation, I think that is bureaucratic corruption, where the delay is meant to make you feel anxious. And that anxiety makes you feel, what do you need? Do you need to be oiled? Do you need to be lubricated? And they would in mind to say, some little tea will be very useful to lubricate the machines so that work can be done. Those kinds of delay, laziness, and bureaucracies that are not necessary, to me, that is corruption. Whether there is exchange of favors, whatever kind, it is corruption. Thank you.
So much. I think quite a lot of things coming up. Some of them requires us to take a common stand on what actually we expect to do in our institutions, what we expect to do in the country, and that's what I think you bring up. And I was thinking, Jury, that it's high time we started having a communique from a training, and from there we can be able to pursue, and that this PFM conference we had here, our training, which had these 7 countries, and this is the feeling of the participants on the various issues you are discussed. I think that one can actually work well, and we document it as part of the next information being shared by APAM to the various public administrators. Thank you so much. Afternoon session very fast, before we appreciate everybody who have spoken this morning. We have moved from morning, mid-morning to afternoon. What was the takeaway from the afternoon session? Audit and compliance. I need hands very fast. Oh, there's a hand behind me and I'm not seeing, so let me move in the front. Any quick takeaway from yesterday afternoon session? Okay. It means there was no takeaway, so we can be able to move, because I'm not seeing any hand. Any hand? Okay, here. We have the 2, 1 and 2, then we stop there. I don't know why most of us are not talking. Does it mean we have not had breakfast? So we start arranging for breakfast before we start sessions? Maybe that's part of the communication we need to do. Okay? No? Okay, there. Then we come back here. Good?
Good morning. I just wanted to congratulate the team. And the one thing that really surprises me, I come from the private sector, and I was appointed to sit on a board of the Kenya Film Commission. And ever since then, especially interacting with Dr. Rory, and also in terms of these sessions, is the amazing documents as well as information and resources that are available for the public sector for us to be able to do a great job. So it's just to commend the team for that, for the documents that we do have. And in terms of the audit and risk, we have all the instruments and information that we need, and just in general around public finance management for us to do a great job and just look after the finances for this country. So it's just to say thank you for the great organization and the documentations that you have provided for us for these sessions. Asante.
Okay, thank you so much, Director, and we appreciate. Yes, we have all the information. What we need is now to put that information into use, and then we are able to realize real value for most of our processes and what we do. Finally, I think you had raised the hand so that we stop there. Yeah.
Well, I fear speaking too much. I may be seen like the good student, yet I know I'm not the good student. Anyway, I think let me make the comment about the audit and compliance. That is what we did in the afternoon. Again, it was very interesting looking at the risk policy, mapping and procedure, changing natures of the international audit functions, and the effectiveness. We learned quite a lot, and I think for me, the takeaway was very important. It's an area that I would say I wasn't very good in it, and I think I learned quite a lot in terms of roles and the new procedures for Kenya, where basically internal audit is strongly separated from management, and the internal auditor is not supposed to participate in a number of management issues like pre-audits. Pre-audits are not encouraged. So I think that session contributed a lot in how we should relate with our internal auditors and external auditors, because quite often what happens in the institutions is that auditors over time have not been liked. They have been seen like they are policing, and that attitude may not be useful, because at the end you have to put stopgap measures to ensure that corrections are done in time before you end up landing into problem. So there was the conceptual framework very well presented from the risk management policy, drafting them, the establishment of risk management framework, defining accountability, who is to do what, and then maintaining and the improvement of risk capacity. All these encompassed within the governance and leadership structure. So I think that was very useful, including how you deal with risk and owners of the risk, identifying them, and the role of the auditors in managing the risk. And of course, there was the areas where risk would be more prevalent, like in could be classified within a strategic area, financial area, operational area, compliance, and environment. I think we really comprehensively covered the issues of audit and compliance, including the role of external auditors. And one interesting thing that was very scary was about when it is adverse, and not only when it is adverse, when the external auditors say they have nothing to comment. A disclaimer. That's quite interesting. Thank you very much.
Thank you so much for that very in-depth presentation of what happened yesterday in the afternoon. And we appreciate that there are quite a number of things which we must go back and implement. And actually not just on book, but it should be seen that it's being implemented and being evaluated for the benefit of the organization. So let's appreciate the speakers for the morning, afternoon, and mid-morning recap. We have had about 5 people who have made that. Kerich there, all the way to my friend here, the 2 teams here and there. Let's appreciate them. Great. Thank you so much. We appreciate for that recap. We need to roll off very fast. We still expect the seats which have not been occupied to be occupied. My fear is that, is it that we are switching into fatigue? You know, as we move towards the end, with this Mombasa weather and the environment, we may have lost some people, but hopefully wherever they are, they will join us in a moment. So this morning, we had scheduled that as the COVID test is being undertaken, and I think a number have already done and they're getting back, we needed also to hear just very briefly on the country status, what the country is doing, and we get to understand really what we are expected to do as citizens of the various countries we come from. Because this is a common enemy. It's not only Kenya, everybody is affected in our respective countries. And so that we understand this thing called first wave, second wave, Now I'm hearing about third wave. I don't know there will be a fourth wave. I'm hearing about variant, a new kind of virus. So we don't know where we are moving to. They said wearing a mask is a new normal. I don't know whether it's no longer, is it new? It's more than 1 year, it's no longer new. So it's like part of our life, yeah? So kids will grow knowing that we wear masks every day. So that's the life which has come up. So we have our officer, the county chief officer for public health, in terms of the setting. When we talk about the county chief officer in the national government, that is like our principal secretary for health. So we have our chief officer for health from the county government of Mombasa, who is going to talk to us about this area. The chief officer is Madam Pauline Oginga, who is with us here. She has a qualification in nursing, public health, and master's in public health, specifically monitoring and evaluation. She's currently in charge of health programs, more specifically the primary health care, which is level 2 and level 1 hospitals in the county. Of course, there is a nomenclature used in classification of the health facilities, and she's also in charge of the COVID-19 initiatives in the county. So ladies and gentlemen, please join me in welcoming Madam Pauline Oginga to speak to us briefly this morning. Let's clap for her as she gets to the podium to speak to us. You use that as a... Yeah, it will be more interactive, so it's just a presentation, not necessarily PowerPoint, but being able to explain to us what is happening and what we need to do. So, karibu sana, Chief.
Good morning, ladies and gentlemen. I don't know whether people took breakfast because Mombasa, we believe in being lively. It's the home of Tarab. It's a tourist destination. So in Mombasa, the weather is always very conducive. We believe so, but I know it's at times it can get pretty hot for those who are coming for the first time, but it takes just a day or two, and you adjust to it. So my name, just like said before, is Pauline Oginga, County Chief Officer Public Health. First and foremost, I will take this opportunity to welcome all of you to Mombasa County. I know we have people from within the country, Kenya. We have visitors from Ghana, Zambia, Ethiopia, South Sudan, and Uganda. And we welcome all of you to Mombasa, all the Nyabos and the Sebos. Feel most welcome in Mombasa. I wish I knew we could have organized with the team to give you a ride around the county to visit some specific sites. So all is not lost. I will discuss with my counterpart in tourism and trade and see if we can organize something for the team. Mine is very simple. First of all, my approach is just to give a brief overview of the county status as far as COVID is concerned, because when I looked at the data, there's basically something on protocol, and also it was protocol and testing. But I believe testing is ongoing. We had our first case in Mombasa last year in March, around 17th of March. That's when we had our first case in Mombasa. And I really want to appreciate this institution because when we had our first cases, it was based on imported cases, and we had to come up very fast with quarantine facilities. And this institution played a very critical role because it was our very first quarantine center for travelers. So, so far we've collected 122,000 samples within Mombasa, and out of that we have 9,000, we've had 9,000 positive cases, and unfortunately we've lost 191 people to COVID-19. When we say 191, those are confirmed cases, because basically what we normally do, even for home deaths, we collect samples to verify whether they're COVID-19 or not. When COVID struck, the first thing that worked for us, because those of us from within the country know quite well that Mombasa was hard hit. Through the leadership of His Excellency the Governor and County Commissioner, we quickly came up with the rapid response teams involving all the stakeholders. And we formed the county rapid response team, then replicated the same at the department level and cascaded up to the facility level. So this comprised of all the stakeholders, including civil society and religious organizations, well-wishers and partners. And through this, we were able to coordinate, mobilize resources, come up with ideas and share on how to curb the spread of COVID-19 at the county. We were one of the counties that went through a lockdown. We had one of the areas within the county going through a lockdown system. And this was as a result of the positivity rate we had at that time. When we collected samples from that area, we had a positivity rate of 30% of that area only. So we were forced to recommend to national government to come up with a lockdown system, because we are also facing a lot of resistance from the community within that area. And we felt that by locking it down, we were going to curb the spread of infection across the county. So prior to doing that, the county took bold steps in ensuring that there's a lot of supply of fresh water within that area. There was supply of food, and when they were given food, the ratio was enough to take care of a whole month. So then we came up with a medical facility within that area to offer medical services. However, we didn't close the doors on those who needed special care from specialized facilities. So just like he said, we came up with the rapid response teams at the county, sub-county, and facility level. And the government shortly rolled out, because initially we were having the compulsory quarantine and compulsory isolation. So we came up with isolation facilities in Technical University of Mombasa. We turned it into an isolation facility, and also we had the Coast General Hospital, where we increased the capacity of intensive care unit. Initially we had 4 beds, but then by the end of it we had 14 beds specifically for intensive care unit. And then we had the high dependent unit as well. So by the end of the day, we had a 60-bed capacity for those for critical care. The reason why we converted the Technical University of Mombasa is because the cases kept on increasing and we needed to expand our facilities. We realized there was a lot of, the majority of our county residents could not afford private facilities, COVID care in private facilities. Because up to date, for you to get care in any private facility within Mombasa, you have to deposit not less than 300,000 shillings before you start receiving care. This is followed by the daily charges, that is above 80,000 per day. So by the end of the day, you stay there for 1 week, you end up having charges of almost 800 to 1 million shillings. Most of the residents cannot afford this. So we expanded the facilities, and between the month of October and December last year, that's when we had the worst peak with more than 3,000 cases per month. And we realized that we are having more than 5 deaths per day. And it forced us now to close 2 other facilities. One was a level 4 sub-county facility and convert it into a COVID isolation facility, and also one health center. The government has been very strict, and we've been working in collaboration with the national government on measures that we are supposed to put in place. And one of the recommendations was on avoiding crowded places. And when in a crowded place, you minimize the amount of time you take in such a crowded place. Simply because of the issues of, there's a tendency of people not wearing masks throughout, and I always make jokes and say it's easy for me to pick out someone who's been putting on a mask or adhering to the instruction of putting on mask throughout, because the lips discolor. If you are there to mask, you realize at some point there's discoloration on your lips. So that is one of always my key point when I'm seated somewhere and I see people not adhering to putting on masks. Like now, I'm seeing someone looking for their masks. That's how I always tell this person is a risk. So one of them is as a county, we took an initiative of assessing most of the facilities, all the hotel industries. We came up with COVID protocols for transport, for hotel industries, small-scale businesses, schools, all the entities, salons, spas, and we categorized these places into minimum risk, moderate risk, and high risk. Some of the places like bars, we categorized as high risk. Reason being, when you walk in, you can easily wash your hands and put on your mask, but the moment you walk into a bar, there's normally loud music, and people tend to socialize. And by that time, the masks are off, people try talking louder than the music, and the spillage of saliva and transmission, the rate of transmission is higher in such kind of places. So we made recommendations on places that we felt were low risk, and we thank the government, at least it was considered. Those places that were deemed low risk were, the ban were lifted. So if you in a place like this, we always make sure that we test staff who are working in hotels, institutions, teachers, business entities. We test them for COVID-19, and the certification is normally valid for a period of 1 month. Then they're supposed to go through another exercise. We gave them a 1-month window based on the fact that most, if you are a Mombasa resident, you will be aware, or a Kenyan, Mombasa County experienced the worst form of COVID-19 in terms of economical impact, given that it's a tourist destination. All our hotels were closed down completely, and staff lost source of employment. And as a result, we had to sit down with stakeholders and come up with measures that were also pocket-friendly for them. So we gave them a leeway of testing these people on a monthly basis to ensure that they are COVID-free. And even if, as they serve people in these entities, they are free from transmission of COVID-19. We also, as a county, came up with nutrition program for our county residents. And during that period of time, we were distributing food. But then, thank God, through the leadership of the county, we reached out to World Food Program and came up with a cash transfer for residents, and also distribution of nutrition commodities and supplements to under 5, pregnant women, and elderly. And it's still ongoing. We started last year, but due to industrial action, the pace was kind of slowed down. So the process is still ongoing. Up to now, we are continuing with the cash transfer and distribution of food in the community. We made a tough decision during that time in regards to availability of safe water. And this is for domestic use, and also to ensure that proper hand washing was taking place. So because hotels were closed, through the executive order, we managed to divert most of the water supply to domestic use. So then we sank more boreholes, and through other partners, we managed to get water tanks and hand washing facilities. And this also helped during December, in preparation for school opening. We distributed hand washing facilities in all schools in preparation for January. And when the schools opened, we also distributed masks in all public health, public primary and secondary schools. The government then rolled out home-based care, and home-based care was embraced in this area because most of the people had stigma in staying in health facilities. So through collaboration with other partners, we've been able to roll out home-based care, and mostly now, most of the cases, the mild cases are attended to at home, and contacts are also managed. They go for self-quarantine at home. We've had various programs on risk management communication, and this is, we've done through radio stations, it's still ongoing, through our community health volunteers, and also through public address system. There's a time we branded vehicles, almost 50 vehicles going around the country, educating and sensitizing people on home-based care. The biggest challenge we're facing right now is information fatigue. There's been a lot of sensitization on COVID-19, and people are getting fatigued at the wrong time, because if you look at the statistics right now, the positivity rates are going high. Mombasa alone, currently we are at around 11.9% positivity rate. And we are experiencing positive cases from imported cases, because we are having ships docking here every day, and we get positive cases from those areas. We have planes coming in. We just received circulars on mandatory compulsory for people from specific countries. So this is the wrong time for us to drop our guard. So one of the key protocol or measures emphasized by the Ministry of Health is hand washing. It's not 1 meter distance, it's 1.5 meters. So we have the 1.5 meter social distance, hand washing often with the soap, and there's a clear guideline on how to do the hand washing. Then sanitizing. We also have, when you're coughing and sneezing, you do it on your elbow, and we at all costs avoid handshake. I really support the issue, and I wish the government could legislate the no handshake issue, because when we are reviewing our data during the COVID period of time, we realized communicable diseases went down significantly. So this explains the importance of washing hands and also not shaking hands, because when you shake hands, there's a lot of transmission of infection from one person to the other. So in one way, we say COVID played a very critical role in preventing transmission of communicable diseases from one point to the other, because there's a period of time in Mombasa we normally experience a lot of communicable diseases, but shock on us this time around, it went to almost zero. So we emphasize adherence to such kind of protocols to our citizens and people who are visiting. As far as the vaccine is concerned, we rolled out the vaccination the other day, and I received my jab. The day before yesterday, there was a lot of fear and stigma that came, and our healthcare workers said, no, we cannot get the jab until the leadership take the first step. So I went and took the first injection, and yesterday the facility now was overwhelmed. Our staff are now all running to get their jabs. So as a county, we received the first 9,000 doses from Ministry of Health. We received communication yesterday that we'll receive another 9,000. So if it's 9,000, you divide by 2, because each person gets 2 jabs. You get the first injection, then 8 weeks later, you get a second one. There's been a lot of rumors going around the COVID vaccine. People say if you're a man, you lose your importance in the house. And if you're a woman, you lose your importance of being a woman in the community, but it's not true. And people talk about so many side effects. And I can attest that when I got my jab, I was observed for 15 minutes. I went back to work. I worked comfortably up to 9 p.m. Yesterday, I was up and about doing my duties, and today I'm also out. The only thing that you're told, you might experience a mild, depending on an individual and on your immune system, you might experience some mild signs and symptoms of COVID. Some are saying they're experiencing chills, some say slight sore throat and all that, but it's expected because something is being introduced in your body, and your body is building antibodies against this infection. So we've rolled out the vaccination at the county, and as at yesterday, we had almost 70 people who had received the COVID vaccination. As far as the new variant is concerned, we are trying to see, because we received some 20 foreign, we received some positive cases through the port, and we are working hand in hand with Cambry Wellcome Trust to do a genotype surveillance and determine whether it is the new variant or if it's the normal COVID that we've been having. But what I can emphasize on is for each and every one of us to take precaution throughout the country. It's just not Mombasa alone. Because with the new variant, it spreads very, very fast, faster than the COVID that we had earlier on. And depending on your immune system, some develop very severe type of infection of COVID. And for those who've had first-hand experience with it, it's not something that you really want to go through as a family or as an individual. There are people who we've seen families completely torn down by COVID-19 just because one case went home and the rest of the family succumbed to the infection. So my emphasis to all of us is do not lower your guards where you are. We are really, really strict on facilities like now where people are converging. The first surfaces are supposed to be clean and disinfected as frequent as possible. And the hotel rooms where people are staying, we really emphasize on the need for fumigation and also to sanitize and disinfect as often as possible. Where there's any laxity, as a county, we move in very fast to curb that. But we really appreciate the support we've been getting from all stakeholders and Ministry of Health towards the fight on COVID-19. It's still not over. We are seeing cases going up. We are seeing beds getting full in the last couple of weeks. So we are far from saying that COVID-19 is over. Thank you.
Thank you so much, the Chief Officer of Public Health Mombasa. Let's appreciate her once more. Yeah, so any comment, question, any reaction before we let her go? So ICT, let me have the mic. I'll start from here. Let's pick this one, another one. Another hand. Okay, let's start with him first. Thank you.
Morning. Thanks for that wonderful presentation. I come from Zambia. Basically, I've been up and down just to, as well as just part of knowing the town itself. And one thing has impressed me is that I see a lot of compliance in terms of people wearing masks here, comparable to where I come from. So I've noted a marked compliance level. I don't know what you are doing for people to comply. I know at home, most people, when the COVID started, when we had some positive cases, is that at some point, even the law enforcement, the police, they would arrest people who are not wearing masks. And even for you to go into a mall, you need to have a mask. So people get a mask just so that they're able to enter the mall. When they enter the mall, they drop it. So it wasn't really, it was just a question of fulfilling. But here you can really see people are wearing masks. So I just want to learn from yourselves, what measures? Is it the level of sensitization? Is it just the people believing that they, maybe because of the high rates initially, but I think there's a feeling as well at home that COVID is fake, that it doesn't really exist, it's just a myth, you know, so people are not so much into it. It's just the recent past, I think with this new strand and whatever, we've had a surge which a lot more people have been dying than was initially, because initially I think it was, even the medical personnel were thinking it was just a hoax. So I wish to commend your county here. I think the measures, whatever you're doing, seems to be working. Yeah. And just for sharing with everybody, is that also I just wanted to share some experience from back home. In my department, my staff would be surprised. Even when I'm alone, I would be wearing a mask. And they were not wearing masks most of the time, you know, because you get used. You think this one we work with and they are okay and all. Until over Christmas period, one of my staff, the father got sick. He had COVID. And later he subsequently died. That's how my entire team started panicking now. They started wearing masks because they knew they interacted with the other workmate of ours and they knew she was closer to the dad, so they started panicking for themselves. And I did visit the COVID isolation center in our country at Levi Mwanawasa, where it's a major one which we use for isolating people, and I learned a few things from there. Remember is that sometimes we take it for granted, like she was saying, people don't wear masks. Yes, you might be worried that you get it from somebody, but you touch so many surfaces. So the mask also protects you from your own hands, from the surfaces you touch, infecting yourself. So it's not just about other people, it's also infecting yourself from the surfaces you touch. So I think it's encouraged that we wear masks as much as possible as we can. Thank you.
Thank you so much for that. So what we did is when, it was not easy, that I can assure you, but we put our foot down because we closed banks in this town. Whenever we got positive cases, we would move in. We closed banks, we closed supermarkets. Whenever we got any positive cases around that place, and it was war, then slowly it sank in and we did a lot of sensitization. We still do that through media, through community health volunteers, because what we started is we stopped community engagement in the initial phases of COVID-19. We suspended. Then come September last year, now we engaged our community health volunteers. So they were trained, and then we also trained youth champions from the communities and used them to reach out to the community, and also the village elders, the local administration, the key gatekeepers and religious organizations. We reached out to them because people had different beliefs and different culture. So we reached out to all of them. They had training specifically to address their specific needs, and also try to sensitize them on the need to adhere to COVID-19. So when we did this last year, we saw a lot of improvement. Then the county has law enforcement team. We combined this with the help of the county commissioner. We brought all the security leadership under one roof, and the county law enforcers. And we planned a county-wide crackdown. We would settle for just a day, where a raid will be done in the morning. And you know, we paralyzed the county for even an hour or two, where if you're not putting on a mask, you get arrested. So it worked for us. People now embrace the culture of putting on masks all over. But I can say the sensitization played a key role. We came up with this when now we had a peak in October to December. That's when now we had two to three raids, courtesy of the county team. And I must say, when security team were also affected, because we lost some of our security personnel to COVID-19, they took it upon themselves. And at times, when you walk around town, out of nowhere, you see someone being picked up, then you realize that person was not wearing a mask. It was a random thing. So it worked for us because, as I told you earlier on, Mombasa was really, really hard hit. In fact, we're number 2 after Nairobi. As far as, there's a time we were number 1 in the whole country. So we took it upon ourselves and did extra work. And I can attest to you, I also collect samples. When my staff are overwhelmed, I step in to collect samples and also engage in the COVID-19 activities.
Thank you so much, our colleague from Zambia, the sharing of experience. and the response. Another comment, question before we make a changeover? Okay, so I believe I want to say that the presentation has been very clear, and the summary you've given is clear, and I believe being quiet meaning that the part of the things the participants are internalizing, given that we also come from different organizations and also countries in this training. The only thing maybe is that I believe the presentation did not make you more depressed, that there is a future. I believe you have given us that assurance, and we are back to our normal. Even the school we crossed actually, and for that time we were like the quarantine center for the country in the region, and so we were actually all of us paralyzed for about 6 months. We never operated, then up to last year, September, when we started resuming our operations, but subject to inspection by the public health. So we also thank your office for always working with us, and I believe they have always been at hand to help us anytime we need their assistance in terms of our participants around and in terms of ensuring that we also abide by the protocols given by the Minister of Health. And this morning we are happy that the public health was able to afford the officers from yesterday to undertake tests of our colleagues who require those tests before traveling. Let's appreciate her for that gesture to us. And let's appreciate her once more for also being with us and presenting this morning. So thank you so much, Chief. We really appreciate. Take our regards back to the county government. Thank you. So thank you so much, and we move out of that session. We need to agree on how we move from here. It has been a good experience sharing, but what is the time now? I need to be guided by the Secretariat, Jury. How do we move from here? So 10:19, I'm told. So that means we have close to 10 minutes before a tea break. So how do we move? I know public participation, the will of the majority. We break for tea. If it's available, you know, we must know that are they ready? If they are not ready, then we cannot be able to break for tea. So I don't know who can check for me very fast. Madam Rebecca, if you can be able to verify. Or Gabriel, just let Gabriel verify that the tea is ready. If it's ready, then if it's ready, let's work on the if condition, yeah? If it's ready, then what next? You take tea for how long? No, it means, remember earlier, one of the directors proposed that we need a mover to amend the program. And now I'm seeing that coming now, at this point, that if tea is ready, then we need to move. Tea is not ready. They are not ready. That means we can move to the next presenter, then we'll see how we amend the rest of the day. So because of that, then let's move to the next presenter. Okay, so the next presenter is here, the moderator is also here, so that makes my work easier, so that at least we have a change of the guard for now. So I welcome the moderator to take us to the next level. Meanwhile, I ask you to stand, just that we stretch as we get to the next session. Let's stand as we have a changeover. Let's stand, all of us. It's good to stand, it's good to stretch. Stretch, stretch. Yeah, I want to try and see how many of you can stand on their toes, yeah? So just step on the toes, try to reach the highest height you can reach, yeah? Let's see who is taller this morning. Who is very tall? I'm just looking at the hands to identify the tallest. Swing, don't just stand there. I want you to swing. Let me see whether you can swing. You don't need to move the body. You're only moving the toes. Just swing. Let's see. Just some people are not doing it. Let's see whether your toes can carry you. Yeah, let's swing. Good, good. Put the hands up. Okay, let's go side. On the side. Let's bend to the left. You know, now this is when we have to check where your left is. Your left is not on my left. Your left is different from mine. Okay, go to the left. Let's go to the left. Okay, let's go back to the right. Right. Good, good. Let's try up. Okay, relax. Let's up. Thank you so much. So our next moderator, Madam Rebecca Kaguru, please take over.
Good morning. How are you? It gives me great pleasure again to be with you this morning. My name is Rebecca, a member of faculty at the Kenya School of Government, Mombasa campus. And I'm going to introduce to you Dr. Moses Mudhenja Mwenda, who is going to be our speaker this morning. You'll be happy to know that Dr. Moses Mudhenja is